Okay, so this is CBT DAMS question discussion. So question number one: which of the following statement is incorrect regarding the Jobs syndrome? So Jobs syndrome, it is also known as hyper IgE syndrome. IgE syndrome. The mode of inheritance is autosomal dominant. It is caused by the mutation of the gene which codes for the transcription factor CAT3. And this syndrome is characterized by main important clinical features are the recurrent skin and lung infections. Lung infections. These lung infections, they are complicated with the nematocysts. Nematocysts. So the statement which is incorrect regarding the Jobs syndrome, nematocysts are present. Yes. There can be some facial dysmorphism. Yes. Recurrent skin infections is yes. But it is an autosomal dominant mode of inheritance. So the answer here will be D option. That is incorrect about the Jobs syndrome. Next question is each of the following is an indication for surgical intervention in those patients who presents with endocarditis except. So treatment of endocarditis is mainly the antibiotic, but there are some indications of surgery. So indications of surgery in cases of infected endocarditis. This indication include number one, CHF and YHA symptoms of more than equal to 3. Number two, if the size of the vegetation is more than 10 millimeters, size of the vegetation. Number three is there is unavailable effective medical treatment for the infective endocarditis. Unavailable effective medical treatment. And that include the fungal endocarditis. Fungal endocarditis. Number four is if there is unstable valve, prostatic valve. Number fifth indication is unresponsive to medical treatment. Medical treatment. Like even after 7 to 10 days, there is no resolution of the fever. We have to go for the surgery. Number six indication is there is recurrent embolisms. Embolisms, or if there is extravalvular infection. Such as valve ring abscess, or there is purulent arthritis. Then surgery should be considered. Surgery should be considered. So, indication of surgery, organism isolated, yes. Fungal organism, if it is isolated, then it becomes an indication for the surgery. Recurrent embolism is yes. Extravalvular infection like valvular abscess. Aortic regurgitation is not an indication for surgery. So question number 2 answer is diffusion. Now question number 3 is all of the following features of are features of juvenile myoclonic epilepsy except. So the features of the juvenile myoclonic epilepsy is the age of onset. So it is the early adolescence. And the clinical features are unique in the sense that these patients will complain of bilateral myoclonic seizures. And they are more frequent in morning after evening. They are precipitated by sleep deprivation. Other seizure type which can be seen here, myoclonic seizures. So other seizure types are, it can be a GTCS or it can be absence seizure. While the treatment response is good, it responds to the medical treatment, antiepileptic medications, and complete remission though is uncommon. Complete remission is uncommon. So the features of myoclonic epilepsy, myoclonus on awakening is true, GTCS is true, absence seizure is true. While automatism is a feature of complex partial seizures. Complex partial seizures, so answer will be automatism. Question number 4. Question number 4 is D brain stimulus for drug resistant epilepsy target which of the following structures? So the D brain stimulus, especially for the refractory epilepsy, it target the anterior nucleus of the thymus. This is the target, anterior nucleus of the thymus, because it is a part of the circuit known as circuit, and therefore it is a relay station. It is a relay station for information which is passing from the amygdala and hippocampus to the cerebral cortex. Cerebral cortex. So this part is deep brain stimulus that will prevent the seizure episode. So answer is the A option. Now number 5. Cerebral ischemia occur when the cerebral blood flow is less than. So if we look at the cerebral blood flow, the resting cerebral blood flow, it is 54 ml per 100 gram per minute. Resting blood flow. While if the blood flow is reduced to 0, if the blood flow becomes 0, so it causes the death of the brain tissue, within 4 to 10 minutes. If the blood flow is less than 16 to 18 ml, it will cause infarction within an hour. The blood flow of less than 20 ml per 100 gram per minute, it will cause the ischemia without infarction. So these are the values. So answer here will be cerebral ischemia when the cerebral blood flow is less than 20 ml per 100 gram per minute. Now the question number 6. Question is, a 60-year-old woman develops a generalized seizure activity lasting for 10 minutes. Seizure activity appeared to arrest after the administration of 4 mg of IV lorazepam. She has chronic kidney disease but otherwise in good health. Which of the following is the best next pharmacological step in the management of this patient? So this patient though has got the seizure activity under control, but once the effect of lorazepam wear off, she might have another episode of seizure activity. Therefore, this patient will need longer acting anti-convulsant treatment is needed for this case. Even the seizure activity is stopped. So the appropriate from the option which are given here, the option of phosphoramidine appears to be a reasonable choice. The option after the seizure activity is arrested might be another seizure activity. While the continuous infusion of midazolam is not indicated in this setting, or propofol infusion is not indicated in this setting, unless there is clinical or EEG evidence of ongoing seizure. So the indication of these infusion is if there is a clinical or EEG evidence of ongoing seizures. So answer here will be C option. Now question number 7. Question is, a child was evaluated by an endocrinologist for precocious puberty. His mother also gave history of psychomotor delay and uncontrollable laughing episodes in the childhood. An MRI was ordered, and what is the most likely diagnosis in this case? So in this case, we can see here the arrow which is pointed here. This is highly suggestive of the hypothalamic hamartoma. Hypothalamic hamartoma. And these they presents with seizure activity, and there is a history of psychomotor delay also associated with laughing associated seizures. A characteristic feature the hypothalamic hamartoma, which is given in the question. Laughing episodes in the so answer here will be C option. Answer will be the C option here. Question number 8. Question is, all of the following antiarrhythmic agents interact predominantly with the fast sodium channels except. So antiarrhythmic drugs can be divided according to their electrophysiological effect on the heart, and known as Vaughan-Williams classification. In which class 1 they act on the sodium channels, sodium channel blockers. These class include Lidocaine, this include Procainamide, this include Pheochromocytoma, Flecainide, so some example of the class 1 agent, while class 2 agents are beta blockers, class 3 agents they prolong the repolation by increasing the action potential duration, And included in this is amiodarone, sotalol, N-Acetyl N-Acetyl The class 4 are the calcium channel blockers. So here the answer will be the C option. While Procainamide, Flecainide, and Lidocaine, they are the class 1, that is the sodium fast, with the fast sodium channels. So C is the false option here, that belong to the class 3. Question number 9. Question is, most common cause of growth hormone releasing hormone mediated acromegaly is. So the answer here is most common cause of growth hormone releasing hormone mediated acromegaly. It is from the carcinoid syndrome. So that is the C option here. Question number 10. Angiofibroma and cholangioма, they are seen in which disorder? So the facial angiofibroma and cholangiomas seen in men type 1. So men type 1 is also known as the Warmer syndrome. Warmer syndrome. And, it is a classical triad of triple P. That is right. Pancreatic, plate cell tumors, pituitary tumors. The most common feature of the main is the hyperthyroidism. The most common enteropancreatic tumor is carcinoma. The most common pituitary tumor is prolactinoma. Other features associated with the Warmer syndrome, they are the renal cortical tumors, tumors, facial angiofibromas, tumors, and lipomas. So facial angiofibroma, cholangioма is a feature of men 1. Now the question number 11. A patient presented with a history of prolonged fever of 3 weeks duration. Given below are the fundus finding and a general examination finding. What is the diagnosis? So in this we can very well see the patient has got this is a retina examination and there are the lesions with the tail center. Erythematous margins with the tail center. This is classically raw spots. And while in the soles, we can see these are the lesions, and these lesions are the lesions. So this is highly characteristic of infective endocarditis. That is question number 11. Answer is infective endocarditis. Now coming to question number 12. Question is, constrictive pericarditis is associated with each of the following except. So constrictive pericarditis, the most common cause of constrictive pericarditis worldwide is idiopathic. The most common cause in India is other causes of constrictive pericarditis. They include the radiation therapy. It includes the rheumatic fever or rheumatic disease, though rare but possible. tissue disorders and connective tissue disorders include SLE, rheumatoid arthritis, and it can be also a sequelae of pulmonary pericarditis. So, answer here will be hypothyroidism. It is not seen in hypothyroidism pericarditis. Now, coming to question number 13. All of the following are typical features of mitral stenosis found on the physical examination except pre-systolic murmur, loud S1, loud S3, mid to late diastolic murmur. So the typical feature, if we look at the S1, so S1 is loud in cases of MS, except it is or associated, it becomes soft. It is loud. S3. S3 is not seen. I'm most likely talking about the left ventricle S3 because there is no left ventricle volume overload. Mitral stenosis. Mitral stenosis does not allow the left ventricle diastolic overflow. So S3 is not seen here. While regarding the murmur of the MS is typically a mid-diastolic murmur after opening snap. Opening snap is the opening of the sudden opening of the mitral valve, and is a murmur mid-diastolic. Just before the systole, there is a pre-systolic accentuation due to the atrial contraction. So, answer here will be the S3 is not seen. The rest of the findings are typical of the mitral stenosis. Question number 14. Identify the finding which is reversible on the physical examination. So this physical finding looks like swan neck or botaneous deformities seen in cases of rheumatoid arthritis. But rheumatoid arthritis is irreversible deformities. So this deformity is reversible, reducible, and it results from the soft tissue anomaly rather than the bone erosions. So soft tissue anomaly like the laxity of the ligament, fibrosis of the capsule, or muscle imbalance. So this occur in cases of Jacob's arthropathy. Jacob's arthropathy was classically associated with acute rheumatic fever. Now it is also seen with the SLE and some neoplasias. So answer here is the C option. Question number 15. Which of the following is the best initial treatment for symptomatic hypercalcemia? So whenever patient comes with a symptomatic hypercalcemia, the number one step and most important step is the hydration. Most important step, because these patients are usually dehydrated because of vomiting, because of the polyuria induced by the hypercalcemia, and that is due in the intravenous normal saline. With hydration, there is increased renal blood flow, increase the glomerular filtration rate, and it will help in increasing the calcium clearance. So even with the plain normal saline, calciuria can occur. After the hydration has been achieved, then we can go for the furosemide. That has got a calciuric effect, but only after hydration has been achieved. Hydration has been achieved. Other drugs which can be used they are bisphosphonates, but they are chronically active after 24 to 48 hours. Bisphosphonates. Then we can also use the phycomycin or calcitonin. Used in they are used in the cases. Even our hydration and furosemide, the calcium level are not decreasing as a refractory measure. While steroids are used especially in cases of the sarcoidosis induced. Hypercalcemia, because sarcoidosis-induced hypercalcemia is due to increased vitamin D, and steroid inhibit the vitamin D synthesis. So the best initial treatment is the hydration with question number. Now question number 16. Which of the statement regarding the diabetes insipidus is true? So in diabetes insipidus, there is the ADH or is resistant, is not working. That is diabetes insipidus. As a result, the feature will be polyuria. Polyuria of urine, because there is more of water in the urine than electrolytes, so urine will be diluted. As a result, urine osmolality will be less than the plasma osmolality. Urine osmolality is usually less than 300 milliosmoles per kg body weight. The plasma sodium. So, plasma sodium, because there is a free water loss through the urine, plasma sodium concentration can increase because of the water loss, free water loss from the body. So concentration of the plasma sodium can be increased in cases of diabetes insipidus patients. While the treatment, especially for the central cause, is the which is a ADH analog. Especially for the central cause of diabetes insipidus, where ADH is defective. ADH is that means ADH is the levels are reduced. So option number 1 is false. That is the high sodium. Plasma and urine osmolality are equal. No, urine osmolality is less. Plasma osmolality is greater than 295. Yes, plasma osmolality can be greater than the 295 because of the high sodium. That is a true statement. Treatment is fluid restriction. No, fluid restriction is done for the ADH, not for diabetes insipidus. So answer is the C option. Question number 17. A patient with which of the following conditions should not be placed on the ketogenic diet? So ketogenic diet, they are useful for a patient of especially if obese patient. While it is indicated for hyperlipidemia, yes, that will help in improving the lipid profile. Rett syndrome, if there is a seizure associated with this syndrome, so it has been shown to improve the seizure frequency. While in cases of pancreatitis, should not be placed on the ketogenic diet. Contraindication for ketogenic diet, it includes hepatic failure, carbohydrate deficiency, and failures. So answer here will be the pancreatitis. It is a contraindication for putting a patient on the ketogenic diet. Question number 18th. Question is, in addition to risk of major congenital malformation, which of the following anti-epileptic drug is also associated with an elevated risk of autism spectrum disorder and a low IQ levels at the age of 6 years? So this is classically seen with the valproate. Women treated with the valproate, either monotherapy or with other anti-epileptic drugs, are at elevated risk of giving birth with major congenital malformations, and this is also associated with a low IQ in cases of the children because of the neurodevelopmental defects in the children exposed during the pregnancy to the valproate agent. So answer is the B option. Question number 19. Question is, all the following cardiac anomalies should receive endocarditis prophylaxis for appropriate indications, except. So the indications of prophylactic endocarditis, it is the infected endocarditis or patient on prosthetic valves, or patient is a case of congenital cyanotic heart disease. If that is unrepaired or repaired within 6 months, while post-cardiac transplant valvulopathy. So these are the indications. Now, in the setting of valvular heart disease, it is lesions or defects where it can be given. It can be given in cases of rheumatic heart disease. It is a stenotic or regurgitant lesion, ventricular septal defects, coarctation of aorta, coarctation of aorta, HOCM, it can be given. Number 5, it can be given if there is mitral valve prolapse with MR, severe MR, it can be given. Isolated secondum atrial defect, it is not indication to receive the prophylaxis because the risk of endocarditis is very low in cases of atrial septal defects. Question number 20. Question is, human ehrlichiosis is characterized by all the following feature except. So this disease is transmitted by tick-borne. This is a tick-borne illness. Shows that most of the cases, mostly, it is asymptomatic. While symptoms are there, it is a fever, headache, there is weight loss, arthralgias. And here the rash is seen in 20% of the patients only, while in the investigations leukopenia and thrombocytopenia are present during the illness. So the characterized by all of the following features except. There are few asymptomatic cases. No, mostly they are asymptomatic. This is a wrong statement. Symptoms include fever, headache, and malaise. True. Rash is present in 20% case. Leukopenia, thrombocytopenia are present. Yes. It is the A option. Now, question number 21. Question is, all the following features are seen in cases of myelopathy except facial sensory impairment. Myelopathy means spinal cord disorder. So facial sensory impairment will be seen because of the trigeminal nucleus. So trigeminal nucleus goes into the spinal cord as far as C3. So spinal cord is involved and trigeminal nucleus will be gone and facial sensory impairment will be seen. Jaw jerk. No. Jaw jerk is a feature of, it is a sensory of trigeminal nerve. The efferent is through trigeminal nerve and the reflex center is in the pons. So this will become a disc in a UMN lesion or a supranuclear lesion or the lesion above the pons. So this jaw jerk is the site is above the pons. Never in a lesion with a spinal cord. In a spinal cord. So this is not seen in case of myelopathy. While the brisk pectoralis reflex is mediated by C5T1, medial and lateral and anterior thoracic nerves. So if there is any lesion above the level of C5 that will produce a hyperactive or a brisk lesion, brisk pectoral jerk. Urgency incontinence of micturition, yes, it can be seen in cases of myelopathy, especially the around the central canal. If there is any lesion around the central canal. Question 22. Question is, most common cause of brain tumor. Most common cause of brain tumor is the secondary, that is the metastatic tumors. The most common primary brain tumor, they are the gliomas. Most common glioma are astrocytoma. Astrocytomas. Number 23. In high-dose dexamethasone test, cortisol production will be unchanged in. That means that high-dose dexamethasone will not suppress the cortisol production, and that is a feature of ACTH secretion. ACTH secreting pituitary tumors, they are suppressed by high dose. They are suppressed by the high dose dexamethasone test. So answer here will be the B option. Number 24. Question is, a 17-year-old girl who was evaluated for short height found to have an enlarged pituitary gland. T4 levels were low and TSH was increased. Which is the most likely diagnosis in this case? So, pituitary adenoma, TSH will be high, and this will lead to T4 to be high. Of central hyperthyroidism, that is at the level of pituitary adenoma. TSH secreting pituitary tumor, same thing. TSH will be high, T3, T4 will be high, which is not our case. TSH is T4 is low, TSH is increased. Thyroid resistance. In cases of thyroid resistance, T3 and T4, these levels are normal or high. Normal or high, so it is not our case. That means T3, T4, they are not working on their receptors. They are not working on their receptors, so the level will not be low. Primary hypothyroidism, T4 will be low, and as a result, TSH will increase. So this is a case of primary hypothyroidism. Question number 25. Question is, rapid, repetitive, coordinated and stereotyped movement, most of them can be mimicked, are known as. First is the chorea. So chorea is a semi-purposeful flowing movement. It is a movement that is fitted from one part of the body to another part. In continuous, random. Lesion of the chorea, it is in the caudate nucleus. Now the embolism. So embolism is a flinging, large amplitude movement, and if it is unilateral, then it is known as hemiplasmus. The lesion is at the level of subthalamic nucleus. Athetosis. Athetosis is a slow rhythm movement, and it is usually of distal part. Distal part. Lesion is at the level of globus pallidus. Globus pallidus. While they are repetitive, stereotypic. Stereotypic means same for a particular patient. Same for a particular patient. These are movements or sounds that are suppressible. And they will relieve a feeling of inner tension. So they indicate a inner tension tics. So the answer here is the tics, the D option, repetitive coordinated stereotypic movement. So these are the questions of CBT medicine 2017. So all the best to all of you for your upcoming exams of All India, AIIMS and other central institute exams.